Hey everybody, it's Mike. It's Monday. It's December 9th, 2024. And this video is going to be an update to a video I did back in March where I took my audience through my cataract situation, and I will give a brief update to what's going on at the end of this video. But also in that March video, I talked about some supplements that I am giving to my dog Charlie, who is a 13-and-a-half-year-old Akita Chow. And there were two issues that I talked about with regard to Charlie. One is because of his age, he's getting a little more stiff. There's some arthritis, and I covered some supplements that have been helping him out. And I'll go through those again, including some additional supplements that he's getting that have been very beneficial. And also to talk through his liver issue. Back 2 years ago, he had an MRI done, and they found a growth or a cyst on his liver. And at the time, they thought it could possibly be cancerous, which, thank God, it was not. And I'm going to take you through a supplement that I believe has worked very, very well in helping him to maintain his liver and kidney health. Okay, so, and I have to give you the obligatory disclaimer. I am not a veterinarian. I'm just relaying information where I have found these supplements to work and to be very helpful for Charlie's health. So the first product, and I think I may have shown this in the first video, is a product called Quay, and it's for joint health. It's glucosamine with MSM, and it's very, very good. And on the back of the bag, it will tell you what the dosage is right here based upon how much your dog weighs. Now, the product that Charlie gets is Dasequin. It's another version of Quay. Quay is actually, we have two dogs. Pablo is our other dog. And he gets this one here. He's 8 years old. And Charlie gets the Dasequin. The Dasequin is a little more potent. And he has done very well on it. The other product that he's been on now for about a month, and I have to say, I've seen a difference. Along with, like I said, the Dasequin working, it's this product here. And the company is Coco and Luna. And I have another supplement, and I'll show you in a bit, that they make for liver and kidney health. This is their turmeric. And this is for joint pain and to reduce any kind of inflammation. And he gets 3 of these pills a day. Again, on the back of the supplement, right here, I'll get it right there, it will tell you the dosage based upon your dog's weight. Now, it took about a month, 30 days, for me to see his mobility get even better. So it was getting better, looking pretty good on the Dasequin, but he was still a little stiff here and there. Sometimes when he sits down, he will kind of like fold his legs and gently place himself down so he can sit or lay down. And I've noticed with this product here that he's sitting and walking. His gait is even better. Okay, so let me just... Okay, so Coco and Luna, and I'll try to put the links down below. Of course, they're going to be U.S. links. Hopefully, you'll be able to find these products or something similar if you don't live in the U.S. Okay, so this is to help them with their joints. It reduces inflammation and helps their mobility. The other product that helps them with their mobility and reduces inflammation and also does a marvelous job of really shining up their coat, giving them healthy skin and a healthy coat, is fish oil. So this product is from NutriVet. He gets 2 of these a day, and he has been for, well, I guess for about a year or so now. I started him on this, maybe even longer, on the fish oil to help him with his mobility. Also, at the time, when I thought it might be the possibility that his growth was cancerous, I started him on vitamin E, which is a very powerful antioxidant. The other thing with vitamin E is, again, it's very beneficial to their coat and their skin. So his fur looks great. It's very shiny. It looks very, very good. In fact, when I go to the vet, she said, for a dog his age, he looks great. And I've taken my vet through all of these supplements so that she can relay the information to other pet owners to hopefully help them. Because, vets, even though my vet's very good, she's an integrative vet, but they still have a tendency to go to the pharmaceuticals. So there's a product like a dog ibuprofen, and they're saying, well, you can give him 1 or 2 of those a day. And I don't want to do that because he's got a growth on his liver. And if I start giving him an ibuprofen type of product, I mean, that's not going to be good. So he doesn't get that. And like I said, he's been doing very well with what I've been giving him. I'm looking around here because I'm trying to figure out what to show you next. Okay, so the other thing too is when they look at his eyes, he had a little bit of, I don't want to say cloudiness, but you can see he's got some age in the eyes. So here's a product, it's called Golden Age Eyesight Chews, and it's also an antioxidant. It's for eye health, eye function, visual clarity. It has zinc, lutein, and some other stuff in it, and he gets 2 of these a day. And when he went to the vet for a blood test about 3 weeks ago, the vet checked his eyes and said his eyes look great, especially for a dog of his age. So this works. So if your dog is having some problems with eyesight, maybe it's cataracts, getting a little cloudy, this is worth a shot. And again, like the other products, it's based upon the dog's weight. So there's really no guesswork. You just look at the back of the container and it will tell you what it is that you need to do. Now, the last thing that Charlie gets, and this is not a supplement. This actually requires a prescription. But what it is like a liquid glucosamine. And you take a syringe and you inject it under the dog's skin. So you lift him up by the scruff. You don't inject it into the body or into the muscle. You don't do that. Just make a little tent, if you will, with the scruff of his neck, and then inject the liquid glucosamine. And the product is called Adequan. See if you can see that. Can you see that? Adequan. Now, it's not cheap. On Pet Meds with a coupon and discounts, you can get $120 gets you 2 of these vials. And but each vial has, I think it's 5 mLs. Yeah, 5 milliliters. And he gets 1.5 milliliters twice a month. Now, in the beginning, you have to give it to him, or give your pet the Adequan once a week for, I think, like 2 weeks. All right, so I know that this is expensive, but I have found with Charlie it has worked. So the combination of the Adequan, the Cosequin or the Dasequin, take your pick, and the turmeric and the fish oil have been very, very helpful. So his movement, his mobility, his gait, he's looking really good. And even in the backyard, sometimes he'll chase a squirrel, and he gets motoring, and he's doing okay. All right, so those are the products for his mobility, his arthritis, being a little stiff, like we all get when we get older. I'm no exception. Okay, so with his last blood test, it came back and said that his liver function is looking good. The enzyme levels did not increase. Now, again, he was diagnosed with the cyst going back 2 years ago. And what happens when the liver has issues, there are enzymes that increase. And that's what was happening to Charlie. And as I said, it was explained that this is very common in dogs. I don't know if it is with cats, but with dogs. And it's something that happens with age. And at the time, they thought that it may be cancerous. And so I had to go talk to a surgeon. And I spoke to the surgeon about what type of operation is required. And the surgeon, to his credit, was very upfront and very honest and said, look, Mike, we really don't know. Even though we have an MRI, we have imaging, we really don't know what we're dealing with until we get in there. And sometimes when we get in there, there's nothing we can do. Or if we get in there, there's the possibility that the dog can bleed out. And I decided that I wasn't going to do that because I wasn't going to have Charlie die on the operating table. My approach to this was, this is the natural cycle of life, and if this is what it is, it's what it is. But that being said, 2 years ago I started him on this other Coco and Luna product, and I showed you this, I think I did in the first video, and it's for liver and kidney health. I swear by this stuff, and I told my vet the same thing. I said, this stuff works. And the way I know this is because with his last blood test, his liver enzymes, which were elevated, did not elevate any further. In other words, they didn't increase. They stayed stable. That's very good. The other thing that the vet told me was that his kidney function was extraordinary for his age. And again, I told him, I actually brought the supplement with me. I said, this stuff, I said, you have to tell other pet owners about this because it works. So this has been very helpful. Now, one of the things that came back with the blood test, the most recent one that Charlie took, was that he was slightly anemic. And the vet said that in all likelihood, it's because of the liver. Even though the liver enzymes stayed stable, he's getting older. And he'll be 14 in May. And so I started him on this supplement here. It's blood support for dogs. And he gets 2 pills a day. Again, the dosage is on the back. For his weight, he's 75 pounds. It says to give him 3 pills. And actually, they're kind of like tablets. Let me show you what they look like. And you can cut them in half. They look like this. Okay. So I started him on 2. And he has to go for blood tests every 6 months because of his liver condition. So hopefully, I'm hoping that this is going to help him with his very mild case of anemia. And I don't know if you can see this. Again, I'll put the link down below. Let's see if I can get that to focus. Maybe not. You can see some of the ingredients. B vitamins, vitamin A, vitamin D3, magnesium, potassium, some calcium, copper, zinc, vitamin B12, iron. Iron is the important part, right? If you have anemia or you're anemic. So this one here is also hopefully a very good product. I mean, the reviews on Amazon, it had a lot of reviews, and it was very, very positive. That's why I went with it. Okay, so hopefully that'll help him with that. All right, so again, these liver and kidney supplements, the supplements for the eyes, the supplements for his mobility, they are all working. I'm not going to say they seem to be working. They are working. And last but not least is this is a Chinese herb called Happy Wanderer. And that's Pablo you hear in the background just barking up a storm. And now Charlie's barking. This helps them to kind of stabilize their mood. So he gets 2 of these pills a day as well. Now, with regard to my eyes, I did the castor oil on the eyelids for 6 months, and I have to be honest with you, I didn't see really any improvement. So I stopped after 6 months. But I was taking this as well. I started off with a different product, and then I switched to this one. It's called Vision, and it's made by Nature Made, and it has vitamin C, vitamin E, copper, zinc, antioxidant support. There's lutein, which is very good for your eyes, and I think that this has helped a bit. What I've noticed is that the sight in my left eye, weirdly enough, seems to be getting better. In other words, I can see from a distance better now with my left eye than I was previously. So something's going on there now. Is it the supplement? I don't know. I'm thinking it could be. The right eye is a little bit of a laggard. I'm not seeing as much of an improvement in the right eye. Now, on the other hand, I don't sense that my cataracts have gotten any worse. So in my last video, I said my eye doctor said that the way they measure cataracts is on a scale of 1 to 10. And if you're at 5 or more, that's when they start talking about cataract surgery. But I'm at around 2 or 3, so I'm not near the 5 range yet. So hopefully I can keep it from progressing. And I think it is not progressing. So I think it's, it's kind of stabilized, if that's the right term. Okay, so anyway, I just wanted to cover all of this with everybody, a little bit of a PSA, because like I said, I love animals, and we have 2 dogs, and like I said, Charlie's 13 and a half, Pablo is 8, and they're part of the family, and we want to make sure that we take care of them. And I think a lot of times what happens is with vets, just like with Western medicine, although like I said, my vet is pretty good as far as being more integrative in their approach, but a lot of vets are not. The first thing you want to do is start to prescribe. And anytime you start prescribing medications and pharmaceuticals, there's all types of other issues and complications and side effects that could crop up and probably will. So, all right, that's pretty much it. That's all this video is going to be about. I will try to get some links down in the description box below if anybody is interested. And comment section is open. I'll answer any questions I can. Again, like I said, I'm not a vet, so I'm not giving medical advice, but I'll give you my honest assessment as to which of these products works the best if you can't afford all of them. I mean, it is expensive, I have to say, okay? So we'll get that out of the way too. So you're going to have to probably prioritize and pick and choose if all of this stuff is not within your bailiwick. Okay, so that's it, everybody. And also, there's a couple of shows coming up. They're basically shows that are wrapping up my wrapping up of the research, and I have wrapped it up. I still get emails from folks asking me, "Are you really out of the game? Have you really retired from the beetles research?" And I have to explain that I'm retiring from the ongoing day in and day out research into the beetles. I don't want to do that anymore because I've taken it, I feel, full circle. I've covered everything that I wanted to cover, with the last piece of it going back to the Frankfurt School and how the Frankfurt School ties into Tavistock and all that stuff. But if somebody's going to reach out to me, a host is going to reach out to me, and they want to talk about the research, or they want to talk about the beetles' alternative narrative that I have put forth, then yeah, I mean, I'm game for that. I'll hook up and talk about it. Okay, and I do have a show going out later this month, December. Yes, December already, man. Happy holidays and Merry Christmas to everybody, by the way, too. I'll do a separate holiday video with Vince Russo. Vince is a really good friend, and I really enjoy speaking with him. Billy Watson as well, so another show's coming out with Billy. Yeah, I think that's about it. And I'm just going to enjoy the holidays. We have the grandkids now. My grandson is 2.5, and our granddaughter is 7 months old. So this Christmas is going to be a lot of fun, and we're going to do Christmas here at the house. my wife and I. So it's going to be a lot of fun. Also, some people are asking me, like, without the beetle research, how do you keep yourself busy? Trust me, there's lots of things that I do that keep me busy. And one of them is a music project that I'm working on. And I may have told some of you this through email and maybe some of the comments and whatnot. But going back 40 years ago, my brother and I wrote a whole stack of songs that we wrote and recorded as demos, but they never saw the light of day. They just basically sat on a shelf. And some of those demos were recorded on 4-track, some on 8-track, some were just 2-track cassettes. And so I said to my brother, I said, hey, we should brush these off. Some of these tunes were pretty good. And he says, yeah, I think it's a great idea. In fact, one of the songs that I just completed, and I'll put a link to it down below if you're interested, is a song titled Vacation in Your Mind. And it was written back in 1979. That was 45 years ago. So when I think about it, I'm going to be 66. When I think about these songs are 40 years old, it's a mind blower, because, you don't think of yourself in terms of being 65 or 70 years old or 50 years old. You still think in terms of when you were younger. At least I do. I don't think old. I think in terms of, I want to do things. I want to get things done. I want new challenges. I want to take on new projects, and I want to experience new things and stuff like that in my life with my wife and our family. So anyway, I'm going on and on here. So again, the comment section is open. I'll do the best I can to answer any questions you might have, and I hope this was helpful. Okay, everybody have a great Monday, and we'll talk soon. Bye now.